What we observe is continued high rate of stunting in sub-Saharan Africa and South Asia, although there has been some convergence in both regions due essentially to a slowing down of the trend in sub-Saharan Africa and an acceleration that is observed in South Asia. There has been an acceleration in stunting decline in lower middle income countries, but a slowdown in the upper middle income countries. The report also analyzes the inequality in nutritional status, which shows that the inequality gaps have continued to be maintained in the SDG period, and wasting status also declining very slowly and more prevalent in South Asian region. So, in summary, the report touches on concluded on many points. First of all, we see there's still a decline, continued decline overall. However, very insufficient to achieve the SDG target for mortality, and specifically in sub-Saharan Africa, slowing down of the progress in East and Southern Africa, whereas West and Central Africa continue to experience very low decline in mortality. South Asia is progressing at a higher rate and has maintained its high rate of decline, although the acceleration that is expected is not happening. Prematurity remains the top cause of death among neonates. Infectious diseases predominate among children 1 to 59 months. Stunting prevalence remains high and declining very slowly. But we observe larger decline in South Asia during the SDG period. The report also highlights the nutrition transition that is happening among older and adolescent girls, whereby there is a rise in obesity that is happening alongside a decline in underweight. All right. This is really a sneak peek of what the report is showing. A lot more is in the report that I invite you to read. Thank you very much.
Thank you very much, Professor Agbesi Amuzu. Now the question remains, what kind of progress were we able to make in terms of equity, quality, and covering? And that's a question for Professor Alujo Barros from University of Pelotas in Brazil. A round of applause for Professor Alujo Barros. Thank you.
Okay, thank you. Well, it's a privilege to be here this afternoon and present a very short summary of what we did in section 3 of this report about trends in health intervention coverage, equity, and service quality. So first, coverage of what? So Countdown, since its start, has been focusing on proven essential health interventions that reduce adverse outcomes, that help decrease maternal and child mortality, and improve nutrition. So to the right, you can see this continuum of care chart that has been sort of a signature graph of all of the Countdown reports that shows exactly the level of coverage for a series of selected interventions. And I will be presenting as well, in terms of trends, the composite coverage index that is a weighted average of 8 selected interventions that help give sort of a general idea of how a country is doing in terms of health coverage. So looking at this graph in a bit more detail, we have a list of essential life-saving interventions. The bars show the median coverage in lower middle-income countries. Sources are different, so the number of countries contributing to each of these bars vary a bit. And looking at it, we see good levels of coverage for some of the interventions, like antenatal care, skilled birth attendant, postnatal care, vaccines. But on the other hand, disappointing coverage levels for family planning, for early initiation of breastfeeding, for mosquito nets. So something's good, something's not so good. Jumping to trends in the CCI coverage, what we see is that, looking at the graph more to the right, where we show all 70 countries, low and middle income countries with data, we clearly see that the speed with which coverage was increasing slows down in the SDG period. So it goes from 1.2 percentage points per year to half percentage point per year in the SDG period. If we examine the middle graph in more detail, Eastern and Southern Africa, we see that deceleration very clearly. So it slowed down, but not only slowed down, it basically stagnated. So from 1.5 percentage points per year to statistically zero progress in the SDG period. And finally, we look at West and Central Africa on the left-hand side graph. And then there is a bit of good news, because in this region, what we see is an acceleration in growth of the CCI coverage from 0.6 to 1.6 percentage points per year, sort of showing that in some places we are sort of doing better, but in most other regions, no. And in the report, you can see what happened in the other regions that I'm not presenting here. Finally, still looking at these graphs, we can see that despite the progress observed, the two regions in sub-Saharan Africa are way behind the average of all the 70 countries. So with Western Central Africa, some 20 percentage points behind the average, not the best. Next, what's happening with equity and why equity? Health is a human right, and everyone has the right to the best achievable health, and that's what we believe. What are health inequalities or inequities? So differences across population groups that are systematic, socially produced, and deemed unjust and unfair. So it is our mission as health professionals to fight against these inequalities and make different groups in terms of wealth, geography, ethnicity have the same levels of health and access to health interventions so that we leave no one behind. What happened with equity? Good news, we had a reduction in health inequalities along all the period we studied, with an actual acceleration in the SDG period compared to the MDG period. And why did this happen? Basically, we see in the lower graph, the smaller one, that among the poorest group, the 20% poorest, the increase in coverage was steady and went on through the whole period. The wealthiest, on the other hand, sort of stalled. So the decrease in inequality is good news. We have less inequalities, less inequities, but stalling the increase among the wealthiest is not a good thing, because it usually mirrors what's going to happen with the poorest and relatively short time. So we have to be careful about that and see what's going on, that we are not managing to improve the wealthiest more than we have now. We also explored some indicators of health service quality, and here we have the antenatal care quality indicator, ANCQ. This indicator is a score that includes information on contact with services, like the number of antenatal care visits, and content of service, including things that were done during antenatal care, like collecting blood or urine and so on. What we present here is the percentage of women that had good quality antenatal care, that is 8 or more points in this indicator. And what we see here, and I highlighted low-income countries, is that most countries had good progress and increased coverage. And that is true for most of the countries we studied, except some upper middle-income countries that already had relatively high coverage. But we see progress, but most of these countries still have a very low coverage of high-quality antenatal care. So there is still a lot of progress to be done. Last bit of information now I will present is about C-sections. And C-sections are a very important intervention to save lives of mothers and newborns. WHO currently recommends around 70% C-sections. That should be enough to cater for medical indications and reduce maternal mortality. But what we see here is, when we look at C-sections among the poorest women and the wealthiest women, the percentage of C-sections among the poorest is low and basically didn't increase from the MDG to the SDG period, while among the wealthiest women we see progress, and in most countries we already have more than the 10% that we are aiming for. So, wealthiest women receiving more than they need, and the poorest women well below the target we have, what is really a big problem and one of the difficulties in reducing further maternal mortality. In summary, what we saw is that coverage with essential health interventions continues to increase in the SDG period, but at a lower pace compared to MDG. Because progress among the poorest was sustained and progress among the wealthiest is stalled, we saw an important reduction in inequalities, but we need to be sort of careful about that and understand what's going on here. There was good progress in most countries in terms of ANC quality, but still many countries with low coverage, and C-section very badly distributed across wealth groups, with wealthiest women having more than they need and the poorest women having way less than they need. So, some good news, some bad news, and much more to read in this report. Thank you.
Thank you very much, Professor Alusio Barros. Alors, mesdames et messieurs, je vais vous demander 1 minute, qu'on se lève tous 1 minute pour accueillir monsieur le ministre de la Santé, Dr Ibrahim Assi, qui va faire son entrée tout de suite dans l'audience. Si on peut l'accueillir sous vos ovations, s'il vous plaît. Sous vos ovations, Monsieur le ministre Dr Ibrahima Sy, ministre de la Santé du Sénégal,
of Senegal,
que nous accueillons
whom we are very happy to receive today for this event. Honorable Minister, you're welcome to this gathering. Thank you very much. Please be seated, Honorable Minister.
Et juste avant
And
laisser Monsieur le ministre
just before giving the floor to the Honorable Minister, we would like to call the high table to come in here and to be ready after the speech of the minister. And for that, I will call the director of Countdown, who is next to me, Dr. Sheikh Mbacke Faye. We also would like to have the representative of WHO, Tam CA, the UNICEF representative, regional director of UNFPA, GFF representative who will give a video message, and representative of PNS and H video, the gate representative also be ready, and also the editor of the Lancet. To all these people be ready, and I'm calling the Honorable Minister of Health of Senegal, Dr. Ibrahima Sy, to come for a speech on Thank you very much. It is a real pleasure for me to be here with you after many, many years of appreciative contribution as a researcher in the Department of Geography. I'm also very happy because I am meeting here people with whom I had worked with in the past. We have Teeth, we have Agbesi, we have Maiga, and we also have many, many others. And I remember also of the heated debate that we used to have when it was about working on these issues, on these reports. And today it is a great pleasure and an honor for me to see all the works that we have been doing be achieved and published in a big journal, a journal with international fame. So this is to tell you the importance that the Ministry of Health and Social Welfare has in relation to, with regard to this report, which help us to take stock of the progress made in a certain number of African countries, but also to address the issues of bottlenecks in relation to the dynamics of the reduction of maternal and infant mortality, particularly in where some areas are later. And it is important to understand what are the determinants and what are the factors of this mortality. I am speaking on behalf of the government of Senegal, the greetings of the authorities, but also I wish you a warmful welcome here in the countries of hospitality. Honorable Director, Permanent Director of the Ministry of Health and Social Director, Honorable Directors and National Directors, Honorable Regional Director of UNFPA, of Western Central Africa, Honorable Regional Director of the Bill Gates, ladies and gentlemen, representative of the civil society organization, of the ladies and gentlemen from the academia and the media, ladies and gentlemen, honorable guests, all protocol observed. It is with a great pleasure today that I am here on behalf of His Excellency, the President of the Republic of Senegal, Bassirou Diomaye Diakhar Faye, for the launching of the Countdown Report 2030 in the Lancet 2025. This report of multi-country analysis of the Countdown 2030 relating to the production of statistics of national and international, relating to the RMNCH on nutrition, is a key instrument for decision making for viable policies. I wish you all, warm welcome to all delegation that have come here to Dakar for this launch, the choice of the country, Senegal, in order to host this important workshop is a testimony of the place that our country occupies in the field of research on the issues of population and health in Africa. It is an activity which comes to strengthen the commitment of the research stakeholders in evidence-based work in order to support decision. This to guide the research program toward the development priorities at nothing, which is a great opportunity of exchange around the issues on the maternal health and infant health. This report is timely to support the efforts deployed by the African governments, in particular the government of Senegal, to support the national analysis in the development of the national estimate, but also at infra-regional with regard to the indicators of the maternal health, child health, and also on nutrition, including gender and equity. Strengthen as well the competence of the national teams in terms of national data relating to the health infrastructures and other data related to health. And as such, we are convinced that the factual data generated by the health system would be at the top for the decision making in order to improve the health of the population and development of the continent. Countdown to 2013 wants to strengthen the capacities of the analysts, specifically the ministries of health, in order to promote an advocacy and the accountability in terms of health of children, adolescents, and women. By focusing on the strengthening of knowledge and analytic knowledge of the countries, and by working in close collaboration with the analysts of the health institution at public level, of the research institution, and of the ministries of health, by working with them, Countdown to 2030 shows the way of a sustainable support for a reliable health system in Africa. Ladies and gentlemen, the health of the women, of the children, and of the adolescent represent for all our countries an absolute priority, a key priority in the light of its contribution to the human development, to their commitment at national level relating to the improvement of the health and to vulnerable layers. Over the last 20 years, the world has progressed in order to improve the survival of the child, and important efforts were made not just to achieve the SDGs from 2015 relating to reduction of maternal mortality and child mortality. The health of the mother and the child is the African region in particular. Maternal mortality has reached unacceptable levels. About 287 delivery in 2020. 87 of the maternal deaths around the world, most of which could have been avoided, happened in sub-Saharan Africa and in Southeast Asia. The neonatal rate of mortality is also the highest in the world, with 27 deaths for 1,000 live births, followed by the one from Asia, with 31 deaths for 1,000 live births. Ladies and gentlemen, Senegal has developed and implemented several plans, the objective of which is to reduce maternal mortality, neonatal and infant mortality. Today, our country is at the crossroad in terms of the maternal health, child health, and adolescent health. According to the last survey, health survey, EDS 2023, maternal mortality is the 153 deaths for 1,000 live births. The rate of infant or juvenile death is 40% for 1,000 live births between 2015 and 2023. The infant mortality rate is 23 for 1,000 live births in 2023, and is a very important share of the deaths of the children under 5. Important efforts were made to achieve this result, among which I can mention the densification of the health map, the promotion of universal health coverage with the free services, the strengthening of capacity in fighting against malnutrition, the immunization through the immunization program, extended immunization program, which has gone from 6 to 12. The effective management of the target disease on the at the community level. One of the most important strategies that target malaria, pneumonia, diarrhea, malnutrition, HIV, TB of the child. The implementation of all these strategies was facilitated and supported by the existence of dynamic civil society, but also with a community health policy. Those interventions have been intensified, will be intensified for the years to come, based on an inclusive and transparent approach with the full and effective participation of the stakeholders in a new vision by the year 2050 for a Senegal that is sovereign, rich, and prosperous. Ladies and gentlemen, I am convinced that a strengthened partnership between the ministries in charge of health and your organization can contribute a lot in enhancing the problem relating to our health system. I would like to thank the technical and financial partners who have supported the holding of this workshop. I also would like to thank our presenters, members of the panel who has come from Africa and other parts of the world. I would like to thank greatly the contribution of this initiative for its efficiency and for the enhancement of the public policies that targets the women and the children in Africa and in Senegal. I would like to congratulate the local organizing committee who has been working for 6 months with the direction of health of the mother, of the child, for the success of this important gathering. I also wish a full, successful deliberation to this meeting on behalf of the President of the Republic, His Excellency Bassirou Diomaye Diakhar Faye, and also for the report of a countdown to 2030 in the Lancet. I thank you for your kind attention. A round of applause for the Minister, Ibrahim Massi, the Minister of Health and Social Welfare of Senegal. After this, we will move on to the comments, and for that, I would like to ask the representative of the Gate Foundation, who is standing, The representative of WHO, you can move ahead. Representative of UNICEF and the regional director of UNFPA, and as well as the editor of the Lancet. So we're going to continue with this session of comment with the director of APHRC, Dr. Sheikh Mbake Faye. Please come ahead for the general conclusion of the first part and then open up the question or the comment session. Thank you very much. First of all, I would like to thank the Minister for having come to this meeting. We know the heavy schedule that he has. I would not have much to say except that I would like to thank you all, but also to invite you to read the report and also to read the recommendations, because it would be useless to do 2 or 3 years of research to have these results, which are very important, and for this to be put in the drawers. And this I'm calling on to the director in charge of the child health and to the ministries and to the programs of the African countries who are following us for this recommendation to be translated into practical actions. And we count, at level of countdown, we count on you for this to be done. I know some countries are already in the trend, and we are ready to support all the countries that want to go in that direction for these actions, for these results to be translated into practical actions. This said, I would like to stop there. Maybe I would ask to give you back the floor. I thank you. Thank you very much, Sheikh Mbake, Dr. Sheikh Mbake Faye. Now, for the second comment, we call representative of the Gate Foundation, Mr. Bahabi Ndongo, for him to make his comment under your applause. Doctor, the floor is yours.
Your Excellency, Minister of Health and Action Sociale. Merci beaucoup pour être venu ici et pour
you for having come here and for having given us the opportunity to discuss with you.
Thanking the organizers for inviting the Gates Foundation. It's been a privilege to be a partner, but also to be here to just hear the progress that we've made. Certainly, we've discussed a lot of statistics today, and you've seen numbers and numbers, and we've had decades of showing numbers. But behind those numbers, there are human beings, there are mothers and children. And in a world where numbers become almost like a routine, I think it's important for us to start unpacking what is behind those numbers, lest we become a little bit more attuned and used to the numbers. There are stories of resilience, yes, behind those numbers, but there are also stories of preventable loss. And that's what makes it very urgent today. Certainly, we've made undeniable progress over the last 2 decades. Since the year 2000, we've been able to reduce maternal death by 40%. Newborn deaths are down by nearly a third. So it's something to celebrate and take time to appreciate that it took a collective effort from all of us. However, today we face stark truth. This progress is slowing, and in some places it is reversing. In 2023 alone, more than 700 women died every day from causes related to pregnancy and childbirth. That's nearly 1 woman every 2 minutes. And most of those deaths occurred in low and lower middle income countries, places where access to care remained deeply unequal, as we've seen from the presentation, and where the consequences of that inequality are often fatal. We must not accept a world where a woman's chance of surviving childbirth depends on where she lives, especially not when we already have the tools to change these stories. Today we have a unique opportunity because not only we are talking about tools that are far away that needs to be developed, We have right now low-cost, high-impact innovation to prevent postpartum hemorrhage, treat anemia, and support healthy pregnancies. These aren't future breakthroughs that we need to look elsewhere. They're right here and right now. As my very good friend Dukure was saying, now is the time to scale. We know what the countries need. Now is the time to listen to the countries and start scaling. The work, therefore, for us is to work with the countries and see how we can move this forward. But they only work if they reach the people who need them. Innovation by themselves, they don't deliver themselves, and they don't save lives if they don't reach the people that need them. So that's why for me here today, I want to talk a little bit more about investments because we are part of the funding agencies and we work closely across with other funders. Investments moving forward will matter, not only in terms of driving efficiency, but also in terms of listening to the countries and aligning to the priorities of the countries. Investment in getting proven technologies to market and making them accessible are going to be very urgent as we move forward. But it's not just about innovations. It's also about innovation and investment in the health workforce, especially midwives and birth attendants who provide respectful, high-quality care before and during and after childbirth. And most importantly, investment in primary health care systems that deliver care close to where women live are going to be crucial as we move forward. Because it's not just about funding healthcare, it's also about strengthening the systems that sustain it. And in the context that we are living in now, we will have to find how to do more with less. Healthy women are the foundation of healthy families. And healthy families are the foundation of strong, thriving communities. When we prioritize women's health, we unlock cascading benefits for education, for economic growth, and also for gender equality. In fact, Monsieur le Ministre, for every dollar invested in women's health yields a threefold return in economic growth. That's not just a smart investment. That's the kind of multiplier effect that changes the future, and that's what we are hearing the governments in this region are calling for. At the Gates Foundation, we believe that creating a world where every person has the opportunity to live a healthy, productive life starts with investing in women. Supporting women's health doesn't just pay off, it actually pays forward. So today, as we reflect on the funding of this Lancet report, and thanks to the team that worked on it, let's be clear-eyed about the challenges that we are facing as we move forward. But let's also be energized by what's possible. We know what works. Now we must act with urgency, with attention.
Thank you very much for your words, Dr. Bahati. So I'm going to call for the next commentary, Dr. Senen Hunun, the Regional Director for West and Central Africa for UNFPA. With your ovations, please. Thank you.
Merci beaucoup.
Thank you very much. His Excellency, Honorable Minister of Health and Social Welfare, honorable members of the government of Senegal, dear colleagues from the academia and of the media, all protocol observe. First of all, allow me to do, as His Excellency, Honorable Minister, to express myself in French, the official language of Senegal. I, first of all, would like to commend the government of Senegal. And when I would mention a few examples, you will realize why it deserves for us to commend the government of Senegal. In less than 6 months, we have hosted here in Senegal the global meeting, every woman, every newborn, and every child we added. It was at King Fahd Palace here in Senegal. We've also hosted here in Senegal, in my institution, 3 major events here. The Permanent Secretary is here, the Global Health on Maternal Health. We also had the global meeting on family planning. And recently, we've also invited ministers and academia to reflect on the roadmap on maternal health in our sub-region. This means that Senegal is a destination, and I think that all those who are here with me can see the organization and the level of expertise to organize these kind of events, and this shows the diplomacy of Senegal, and this requires some applause. I also would like to thank Countdown to 2030. Just like you, Honorable Minister, I was in the academic world and I contributed to many of those reports. So it is a great pleasure for me to see you here, to see people with whom I published articles, and we discussed a lot on those topics. Agbesi, Tis Burma, I see Maiga, you mentioned. So for me, it is a double pleasure. We have reached 2 objectives, and I would like to remove my hat of Director General, but also to come and see my old friends and to contribute to the reflection. I have 3 comments I would like to make. My comments, I always ask my question as to how do we help somebody just like Professor Ibrahim Massi. I will tell you an anecdote or a story, and you will understand my 3 recommendations. In 2005, I was working on the greatest project of maternal health funded by GAIC, known as ERPACT. We worked for 5 years, and we published a publication report, and we went to meet the Ministry of Health of Burkina Faso at the time, because we had some sites. Mr. Alain Yoda, who is an economist, and we finished presenting all the outcomes of the report, and he looked at us like that, and Wendigram, your friend was there, who was leading the delegation, spent 5 years to come and tell me that I have to increase accessibility of the health services to the mother and to the child. He did not wait for us to know that and you will understand why I am doing all this work with my friends. And in my current position, I would like to insist on 3 things. Alusio mentioned that very quickly. It is not a question of health. He said that it's a question of right. But I would like to add that it is a fundamental issue of development. And you said it, Mr. Honorable Minister. So we have the habit, we all who are in this room, we have the habit of using to look at the health system of our country. When I listened to Tis Burma in his presentation, I was very happy because he insisted a lot on what we usually call in our jargon, what we call the non-medical determinant, the social determinants, and so on. And he talked about the economic difficulties, the issues of governance, of human